Welcome to the Art of Living Free series with Anthony Silard, brought to you by theartoflivingfree.org. Today, Dr. Silard explores why the worst health crisis for teens emerged long before COVID-19.
Hello, I'm Anthony Silard, and welcome to the Art of Living Free. Today, we're going to explore how the worst public health crisis for teens and young adults began way before COVID-19. So, as you may be aware, back in January of 2020, Cigna, the healthcare company, did a survey of over 10,000 American adults, and they found that 61% of them, over 3 in 5, were lonely, scoring an extreme level of loneliness in the UCLA Revised Loneliness Scale. So never in human history have we been this lonely. Now, many people think, wow, that's really bad. And when I often at conferences, I share this. And what people often say is, I need to go and volunteer at an elderly home because I see how people can be lonely there. And well, you know what I say? I said, you know what? That's a great idea. You should go and do that. And many elderly people are lonely. But guess what? For the first time in US history, it's not the elderly who are the loneliest in our society. You know who the loneliest are? It's teens, or what are called Gen Zers, and young adults who are called millennials. They are the loneliest in our society today. So what happens when we're lonely? Well, a lot of negative things. So for one, it tends to dysregulate us, so we don't regulate our emotions as well. There's a lot of studies showing that. Also, research that I've done with Sarah Wright at the University of Canterbury in New Zealand, we found in a couple of papers that we published that there's actually a kind of like a vicious circle, which is that when someone feels lonely, they start to feel because it's dysregulating them. They're having trouble regulating their emotions. So they're not showing up as well in conversations with others. So when they communicate with others, they interact with others, they feel a little awkward, uncomfortable. They're either expressing too much emotion or not expressing enough emotion. Either way, they're kind of missing some of the social and nonverbal cues that are so core to communication because they're feeling lonely, because it's dysregulating them. And then what happens? They push people away. Others are not as interested in forming relationships or building relationships with them, and then they become lonelier. So it's this vicious circle where first they start to feel lonely, then they become more socially uncomfortable, and then through often rejection from others, they become even lonelier, and just keeps going and going and going. Other thing is that lonely people don't tend to volunteer as much, they don't tend to help others as much. A lot of the positive outcomes we see in our society, when the lonelier we become, the less we engage in those kinds of positive behaviors. Okay, so there are also some other behavioral outcomes for teens and young adults that were happening way before the pandemic and are just getting worse. Let's take a look at two more of those. Let's take a look first at self-harm. So self-harm is, for example, when you're cutting yourself, cutting your arm or your leg or some part of your body. And many people would say, well, why would someone do that? Like, why would somebody cut themselves? That doesn't make any sense. Well, research by Bessel van der Kolk at Boston University, a psychiatrist, what he said made a lot of sense to me, and from conversations, interviews I've done with people, is that when someone feels numb, cutting themselves helps them to feel something. Now, the more time that we spend on our phones, the number we become. And actually, there's research, for example, by Ryan Dwyer at University of British Columbia, that the more time we spend on our phones, the less we enjoy face-to-face interactions with others. That could be partly related to loneliness, remember, because when we're lonely, we don't interact as well with others. This is a very dystopian finding, because then what happens is people then say, okay, I've been on my phone 3 hours, on my laptop, let me go talk with one of my family members or a friend, and I didn't really enjoy that so much. We didn't have a very good interaction because you've been losing your practice in those interactions. And then, you know what, let me get back to my screen. right? And so we start to become less and less equipped for face-to-face interaction. So why would someone cut themselves? Well, one reason is just to feel something, anything. The other reason is to feel an emotion different than the negative feelings of rejection, insecurity, anxiety about interacting with others, the more that time they spend on their phones. So there's a very interesting study that was published recently in the Journal of the American Medical Association. And this study involved over 43,000 incidences of self-inflicted injuries across 66 emergency rooms at hospitals across the United States. So a very, very robust study. And what they found was they studied between the period of 2001 and 2015. And they wanted to see these self-inflicted injuries, how much are they going up during this period, if at all? Well, what they found was, for boys, there was really no increase that was statistically significant. So self-harm was not increasing among boys between 2001 and 2015. Now, for girls and young women, they found pretty much the same thing from 2001 to 2008. No change, no statistically significant change in the number of incidences of self-harm. Then in 2009, now keep in mind, 2009 is about a year and a half after the release of the first smartphone. It was the release of the first iPhone. In 2009, you remember Steve Jobs in his black turtleneck announcing it at the Apple convention. Well, a year and a half later, in 2009, let's take a look at what happened for girls and young women. This was very surprising because, again, from 2001 to 2008, there was no change in self-harm among girls and young women. 2009, an 8.4% increase in self-inflicted injuries. And this includes poisoning, cutting, hitting oneself with a blunt object. 8.4% among all girls and young women in 2009, a year and a half after the release of the first iPhone. Now, among girls ages 10 to 14, here's the really shocking part. There was an increase that was more than double of the overall increase for girls and young women. An 18.8% increase in self-inflicted injuries in emergency rooms across the US among girls ages 10 to 14. So you may be saying, well, that's a fluke, that's just 1 year, you know, so there were more self-inflicted injuries in 2009. It probably goes down again the next year. Well, guess what? It doesn't. And not only that, and here's the sort of the chilling, I get chills when I say this. This is the chilling and disconcerting finding from this study. In every year from 2009 to 2015 at the end of the study, in every single year, there's an 8.4% average increase in self-inflicted injuries among all girls and young women. And for girls ages 10 to 14, that increase is 18.8% annually from 2009 to 2015. So it's not a drop in the bucket, it's not a fluke. This is a societal shift in the self-harm of girls and young women. And you may say to yourself, like, well, why is this happening, right? And you know, why among girls and young women? Well, there's a lot of reasons, okay? And I think we're never going to know, you know, whenever you look at one of these kinds of studies, you try to figure, well, what are the causes here, right? So the study authors attribute it to a number of things, to social isolation that comes from increased screen use, from cyberbullying, and there's other research that's found that cyberbullying is much more distressing on an individual than actual face-to-face bullying, because you know they're at home alone, or they're behind their screen by themselves, or in these four walls of their room, and they're being bullied or feeling rejection or ostracism, or you know, so that's a big part of it. Another reason the study authors attribute to the increase in self-harm is the actual propagation of self-harm techniques by social media itself. Social media has been used by girls and young women who have been, who have engaged in self-harm and in self-inflicted injuries to share techniques with each other. So that's another part. But it seems like the greater part is related to this social isolation, this loneliness from not interacting as much with other people face-to-face, but instead by social media.
Life offers us many challenges, and the artoflivingfree.org offers new ways of thinking so we can see these challenges from a new angle and overcome them. Whether it's Anthony Silard's free blog, video or podcast series, his book, Screened In: The Art of Living Free in the Digital Age, or personalized courses, theartoflivingfree.org will help you refine your life vision and then transform it into action. Find out more at theartoflivingfree.org.